Hello everyone, this is my presentation for Pure OCD, aka Purely Obsessional OCD. So it's called Pure OCD because it purely happens mostly in your mind. So we all know with Obsessive-Compulsive Disorder, there are visible compulsions that people perform to alleviate the anxiety associated with their intrusive thoughts. But with Pure OCD, it mostly happens in the mind. So this subtype is actually not commonly recognized by many psychologists as real, but it doesn't really make sense to me because as psychologists, we know like everything happens in the mind. So it's just very strange that they don't talk about this more or really give it the recognition that it needs. And as someone who has this, like, I'm very passionate about it, and it is my pleasure today to be able to inform you guys more about this subtype of OCD. Yes, and I'm very grateful for the professor. Thank you, professor, for letting me speak on this subject today because I've been waiting so long to be able to speak on pure OCD because I've read so many things, heard so many things from licensed psychologists doubting this, doubting my experience, and I'm just so grateful that I'm able to speak about this today with you guys. But yes, it's basically a subtype of OCD where the compulsions are purely mental. Not always. You could have pure OCD and you could still have compulsions, but you don't recognize them. See, there are many compulsions with people with pure OCD, like avoidance behaviors, stuff like that, but I'm gonna get into that in 1 minute. I don't want to get ahead of myself. So a day in the life of someone with pure OCD is very similar to the day in the life of someone with, the known obsessive compulsive disorder. So it's filled with fear, terror, panic, doubts of who you are as a person, your character, and this all stems from intrusive thoughts, which we all experience. So people without OCD experience intrusive thoughts. They're basically those weird thoughts that you get when, like, I don't know, you're driving and you're like, oh, what if I just like drove my car off the road right now? Stuff like that. Like just random thoughts that have no correlation to your character. You have no desire to act out on them. They actually are completely the opposite of what you want to do. And someone without OCD could easily let go of these thoughts and be like, okay, that was weird. But someone with OCD holds on to that thought and starts to doubt their character or what they're capable of, and it becomes a very scary, debilitating experience for the person suffering with OCD. So basically, your entire identity becomes a question. Everything becomes a question of, what if? Am I capable of this? Do I desire this? Stuff like that, and it consumes your whole world to the point where you don't even know who you are. You start avoiding things that you used to love because you have this irrational fear that you are capable of this disturbing thought that you don't even desire at all. And it's simply debilitating. And someone with pure OCD, unlike someone with, you know, the known type of obsessive compulsive disorder, has mainly mental compulsions and symptoms versus somebody with the typically known OCD, where they'll wash their hands, they'll, check certain things to make sure, they're safe or they're not intentionally trying to do something wrong, or if they accidentally do something wrong, stuff like that. But people with pure OCD don't really have physical compulsions they can perform to alleviate that anxiety. It's basically all mental, which is the main key difference between the two subtypes of OCD. So the main key symptom of pure OCD is persistent, unwanted, intrusive thoughts. So everyone with OCD has intrusive thoughts, but with pure OCD, like I said, it's very mental. So they all have the same theme, the intrusive thoughts, the obsessions, but there could be any theme, but usually the theme just simply goes against how you truly feel, what you truly want, and pure OCD attacks the things that you love. So let's say you love being religious, you're very religious, you love God, you pray all the time. When you have pure OCD, your OCD will start to convince you, do I not like God? Do I not believe in this religion? What if what if I'm a sinner? What if God doesn't love me? what if I'm not actually Catholic? What if like I'm actually a Satanist? Like your brain will just start thinking these random things. And like I said, instead of just brushing them off, because anyone with OCD would just brush it off and be like, that's not really how I feel. Someone with pure OCD will actually go to great lengths to figure out, is this true? Is this how I feel? I call it basically the what if disorder because you basically question everything, and OCD usually attacks the things that you love. So, for example, one of the main themes of pure OCD is the fear that you might just snap and harm yourself or somebody else. And clearly, most people don't want to do that, right? And the person with OCD knows they don't want to do this, but it's fear-based. So, for example, like doubting one's sexual orientation. So, let's say someone who is straight and they know they're straight has an intrusive thought that's homosexual in nature. Instead of just letting it go and being like, oh, I know I'm straight, that's not how I feel, they start actually believing, wait a second, like, do I feel like this? Do I want this? Do I like this? And they start questioning their whole identity. Um, a big, humongous symptom is the fear of being psychotic or that you are psychotic. So, like, when I went through this, like, I actually thought I was crazy. And, like, I was like, why am I having these thoughts? And why are they making me terrified all of a sudden? Because I had intrusive thoughts my whole life. But once I hit my like later like teen years, like early 20s, I was like, why all of a sudden are these thoughts actually making me have panic attacks and anxiety? I spent maybe 3 years of my life avoiding bridges because I convinced myself that if I go over a bridge, I might just jump off of it, and I have no desire to jump off of a bridge, and I definitely want to live. So when I had that thought, I was like, what if this happens? Is this going to happen? Is this how I feel? It is not how I feel. And I've been going through this for years of my life, so I know how to kind of like deal with these thoughts now. But it's just all of the subtypes of OCD go against how you actually feel and what you desire. Oh yeah, the fear of blurting something out. Oh my God. Like basically the person with pure OCD is afraid that maybe they're in like a room, they might randomly say something inappropriate. Like they might get a thought and be like, okay, but what if you just say this right now? And then your brain starts panicking, anxiety, like, oh my God, are you going to say this? Stuff like that. So, yes, all the themes can vary from person to person. There's so many other themes that I could discuss, but like these are the main themes. It's just the fear that you're going to either act out of character, that you are not what you believe you are, or that you're capable of something bad. And what I have researched about this and what I know about myself and other people that have OCD, they never, ever would act or have the desire to act. And if anything, these are their biggest fears. And their brain holds on to these fears and tries to convince the person that it's reality when it's not reality. So the compulsions, yes, there are compulsions, like I said, but they're purely mental usually. So basically, someone with pure OCD needs reassurance. They will constantly ask the people around them, do you think I'm a bad person? Do you think I'm capable of this? Do you think I'm dangerous? Do you think I'm actually religious? Do you think I'm gay? I don't feel like I have these desires, but do you think I'm gay? Like, do I seem gay? Like, they'll start like they need an answer. So when they ask these reassuring questions, they get temporary relief from the anxiety that they feel from the intrusive thoughts. Oh my God, yes. So another compulsion is like repeatedly going over the past. So if someone has relationship OCD, which is another subtype of OCD, which mainly correlates with pure OCD, let's say they go out and they have a long night of drinking, and they remember the night for the most part, but they wake up the next morning and then they're like, what if I cheated on my partner and I just don't remember? But they know they didn't. They would remember that, right? But OCD crawls into the picture and is like, well, what if you don't remember? And then they basically go on an anxiety-ridden journey where they go over all the course of events. They go back to all the people that were at the party and say, who did you see me with? How was I acting? Was I acting out of character? How long did I disappear for? Stuff like that. So they're going over the events to make sure that this feared event did not happen. And when people say, no, I didn't see you disappear for that long, or no, I didn't see you doing anything out of character, no, you weren't dancing provocatively, they immediately feel relief. Only for a short while, because the thoughts always return, but they immediately feel relief because that is their compulsion, reassurance, going over past events, and you cannot see these things on the surface. That's why it's shocking that psychologists brush this disorder off as not being real OCD when it's very real. Oh, avoidance behavior. So with me, this is like my main compulsion with pure OCD. So I avoid so many places because I've had an intrusive thought about the place, or I convinced myself, oh, if I go here, like, then my intrusive obsession will come true. So then I actually became housebound. I still kind of am, but like, I became housebound because I was like, oh, if you go past this block in your neighborhood, you might pass out, so you can't go over there. Or I'll have thoughts like, oh, if you go to this place, this thing will happen, so you can't go. And I actually listened to the OCD, and I like basically wasted years of my life in isolation, which is horrible. So OCD can make normal things that people do on a regular basis impossible. Because yes, we all know there are rational fears, but to the person with pure OCD, it feels very real, and the fear is debilitating. Okay, yeah, so people with pure OCD might cope with alcohol or drug usage because these things might stop the thoughts from happening, or the anxiety associated with the thoughts are lessened, so they find a way to relax and not have to feel the symptoms so heavily when they drink or, do recreational drugs, which I really think is so sad because people that have to cope with these things when suffering from these disorders, they don't deserve to put poison in their body, but unfortunately, sometimes they feel like they have no choice because they don't know how to stop these fears and the anxiety associated with this disorder from taking over their mood. They just want to feel happy for a little bit, and sometimes it's very hard when you have pure OCD. So there are many factors that contribute to the development of OCD. One of them is genetic predisposition, which makes sense because a lot of the people I know, including myself, have family members that have OCD. 45 to 65% of the variance of OCD is attributable to genetic factors. So, Brock Haney, 2023. The lifetime prevalence of OCD is 1.6 to 2.3%. So, I feel like as people get older, sometimes, like especially with pure OCD, I feel like it might fade away with age. But I feel like most of the older people have like the bad compulsions, like with the main type of OCD that we know. The average age of onset is 19. That's literally when my OCD got really bad. It's hereditary as well, genetics. Oh, it's linked to neurological disorders such as Parkinson's, traumatic brain injury, Tourette syndrome, Huntington's disease, and epilepsy. So I think there's definitely a strong correlation with OCD and like neurological conditions. So the prevalence of OCD/ pure OCD, 50% of those with OCD have the onset of symptoms in childhood and teenagehood. It is uncommon for the initial onset of OCD to present itself over the age of 40. So usually people that have OCD figure it out early in life. 90% of individuals with OCD have comorbid psychiatric diagnoses, most commonly anxiety disorders, which makes a lot of sense because the intrusive thoughts cause massive amounts of anxiety, and mainly the only reason why people even perform compulsions to begin with is to alleviate that anxiety associated with the intrusive thoughts. Women are 1.6 times more likely to experience OCD compared to men. And postpartum women are twice more likely to develop OCD than the average person. So like we said, OCD attacks the things that we love, right? So it only makes sense that a woman that just gave birth might start having intrusive thoughts about her baby, because she actually cherishes and loves the baby. And if you have OCD, if you're predisposed to developing OCD, you might start having intrusive thoughts after birth. So from my research, it wasn't really so known where OCD truly originates from in the brain, but it said that it originates in the orbitofrontal cortex and the ventromedial stratum. So, you know, and differences in the frontal cortex. So a lot of anxiety disorders, panic disorders, it's all going on in the frontal cortex. And imbalance in serotonin and GABA, of course, glutamate, are associated with symptoms of OCD. So serotonin, GABA, those are in charge of keeping you calm, happy, anxiety-free. So if you have an imbalance with serotonin and GABA, you're going to start getting anxiety, and especially if you have intrusive thoughts, let's say you develop an imbalance, thoughts that didn't bother you prior could start giving you anxiety if you have an imbalance. So what I wanted to disclose about the diagnosis of pure OCD, so many people with pure OCD are worried to go and seek help because they're afraid that if they confess their intrusive thoughts to a professional, that the professional will think that they're either schizophrenic or they actually want to commit these acts when, like I said, the whole thing with OCD and pure OCD is that we do not want these things to happen. These are our biggest fears. But OCD makes us obsess about them and doubt them and talk about them. And, when you confess that to a professional, of course, your biggest fear is, what if they think I actually want to do this? I don't want to do this. The whole point is that they don't actually want to do these things. So the diagnosis really, especially me, I never actually got help for it because I was afraid that they would think that I'm crazy when people with pure OCD are not crazy. We're actually very, very aware of ourselves and our emotions and how we really feel. That's why we're always questioning everything. But the diagnosis is the same as any psychiatric diagnosis. They'll be asked family history of the disorder, asked about the amount of time spent and thoughts on compulsions, the impact that these thoughts and feelings have on the individual's day-to-day functioning, which pure OCD could destroy your functioning. Um, the presence of these symptoms will be measured, and then they will also be asked if they use drugs or alcohol to cope with their symptoms of pure OCD. The good news about any obsessive compulsive disorder is that there is hope and there is treatment. So there's multiple types of therapies, multiple types of medications that could help with your symptoms of this disorder. So CBT, of course, very common for many psychiatric diagnoses, basically teaches the patient how to cope, handle their thoughts in different ways, which will make it easier for them to live with their diagnosis. ERT, okay, exposure response therapy is the mainly recommended way to help the person recover. So ERT could actually help them fully recover, but it's the scariest type of therapy that someone with OCD can seek because they are forced to be exposed to their fears. So someone that goes to ER, let's say someone that has pure OCD gets exposure response therapy and their main obsession is harm, right? That they might harm themselves or harm someone else, right? So if they have a good psychologist who doesn't call them schizo, right? The psychologist will actually hand them an object that brings on feelings of anxiety and basically forces them to see that they are not going to do this, that they are not capable of this. So let's say someone is afraid they'll hurt someone, right? In ERT, they will hand the patient a knife and be like, now what? And wait. And 9 times out of 10, actually probably 100% of the time, the person with pure OCD does not act on the intrusive thought because we all know that the person with pure OCD does not want this to happen, and it's all fear-based. So that is the best way to recover from pure OCD, exposure response therapy. And then, of course, SSRIs could be prescribed for any type of obsessive compulsive disorder. It could alleviate the feelings of anxiety. And of course, we could assume, obviously, that OCD could cause depression, and SSRIs are mainly prescribed for depression. So, but when you're experiencing such a debilitating disorder, depression can also become a thing in your life when you have pure OCD. But SSRIs are good for multiple things, not just depression. So in conclusion, pure OCD is a very real subtype of OCD that goes unfortunately highly unrecognized, and it consists of excessively ruminating, seeking reassurance, going over intrusive thoughts, questioning yourself, your reality, who you are, all because of an intrusive thought that gets you to question your entire reality and turns into an obsession. And all obsessive compulsive disorders greatly reduce your quality of life, which it's good. It's good that there's so many treatment options for this and ways to cope and learn to live with this disorder and possibly completely recover. If you're always living in a state where you're questioning, what if? Do I want this? Do I desire this? When you know that you don't want these things and you can't stop thinking about it, it's just a very sad existence to live in. And you know what I mean? As someone who suffers from this, I could say that my recovery process from 3 years ago compared to now, I have learned so many ways to just deal with what I'm experiencing. And I'm just happy that I got to talk about this with you guys today and educate you guys more on what pure OCD is. And thank you to the professor for letting me speak on this today. Um, but yes, there is always hope. Thank you guys. Thank you for watching my presentation. And I hope you guys learned something about pure OCD.